Today the topic which I'm gonna share with you people is diabetes. What is diabetes? Types of diabetes. Symptoms of diabetes: men, women. Types 1 diabetes. Type 2 diabetes. Gestational diabetes. Causes of diabetes. Diabetes of risk factor. Diabetes complication. Keep watching this video till end. If you like this video, give it a big thumbs up and please subscribe to my YouTube channel. Keep your notification on. What is diabetes? Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Diabetes types. Diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either doesn't make enough insulin or can't effectively use the insulin it does make. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. There are a few different types of diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas, where insulin is made. It's unclear what causes this attack. About 10% of people with diabetes have this type. Type 2 diabetes occurs when your body becomes resistant to insulin, and sugar builds up in your blood. Prediabetes occurs when your blood sugar is higher than normal, but it's not high enough for a diagnosis of type 2 diabetes. Gestational diabetes is high blood sugar during pregnancy. Insulin-blocking hormones produced by the placenta cause this type of diabetes. A rare condition called diabetes insipidus is not related to diabetes mellitus, although it has a similar name. It's a different condition in which your kidneys remove too much fluid from your body. Each type of diabetes has unique symptoms, causes, and treatments. Learn more about how these types differ from one another. Symptoms of diabetes. Diabetes symptoms are caused by rising blood sugar. General symptoms. The general symptoms of diabetes include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that don't heal. Symptoms in men. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction (ED), and poor muscle strength. Symptoms in women. Women with diabetes can also have symptoms such as urinary tract infections, yeast infections, and dry, itchy skin. Type 1 diabetes. Symptoms of type 1 diabetes can include extreme hunger, increased thirst, unintentional weight loss, frequent urination, blurry vision, tiredness. It may also result in mood changes. Type 2 diabetes. Symptoms of type 2 diabetes can include increased hunger, increased thirst, increased urination, blurry vision, tiredness, sores that are slow to heal. It may also cause recurring infections. This is because elevated glucose levels make it harder for the body to heal. Gestational diabetes. Most women with gestational diabetes don't have any symptoms. The condition is often detected during a routine blood sugar test or oral glucose tolerance test that is usually performed between the 24th and 28th weeks of gestation. In rare cases, a woman with gestational diabetes will also experience increased thirst or urination. The bottom line. Diabetes symptoms can be so mild that they're hard to spot at first. Learn which signs should prompt a trip to the doctor. Causes of diabetes. Different causes are associated with each type of diabetes. Type 1 diabetes. Doctors don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Genes may play a role in some people. It's also possible that a virus sets off the immune system attack. Type 2 diabetes. Type 2 diabetes stems from a combination of genetics and lifestyle factors. Being overweight or obese increases your risk too. Carrying extra weight, especially in your belly, makes your cells more resistant to the effects of insulin on your blood sugar. This condition runs in families. Family members share genes that make them more likely to get type 2 diabetes and to be overweight. Gestational diabetes. Gestational diabetes is the result of hormonal changes during pregnancy. The placenta produces hormones that make a pregnant woman's cells less sensitive to the effects of insulin. This can cause high blood sugar during pregnancy. Women who are overweight when they get pregnant or who gain too much weight during their pregnancy are more likely to get gestational diabetes. The bottom line: both genes and environmental factors play a role in triggering diabetes. Get more information here on the causes of diabetes. Diabetes risk factors. Certain factors increase your risk for diabetes. Type 1 diabetes. You're more likely to get type 1 diabetes if you're a child or teenager, you have a parent or sibling with the condition, or you carry certain genes that are linked to the disease. Type 2 diabetes. Your risk for type 2 diabetes increases if you are overweight, are age 45 or older, have a parent or sibling with the condition, aren't physically active, have had gestational diabetes, have prediabetes, have high blood pressure, high cholesterol, or high triglycerides, have African American, Hispanic or Latino American, Alaska Native, Pacific Islander, American Indian, or Asian American ancestry. Gestational diabetes. Your risk for gestational diabetes increases if you are overweight, are over age 25, had gestational diabetes during a past pregnancy, have given birth to a baby weighing more than 9 pounds, have a family history of type 2 diabetes, have polycystic ovary syndrome (PCOS). The bottom line: your family, environment, and pre-existing medical conditions can all affect your odds of developing diabetes. Find out which risks you can control and which ones you can't. Diabetes complications. High blood sugar damages organs and tissues throughout your body. The higher your blood sugar is and the longer you live with it, the greater your risk for complications. Complications associated with diabetes include heart disease, heart attack, and stroke, neuropathy, nephropathy, retinopathy and vision loss, hearing loss, foot damage such as infections and sores that don't heal, skin conditions such as bacterial and fungal infections, depression, dementia. Gestational diabetes. Uncontrolled gestational diabetes can lead to problems that affect both the mother and baby. Complications affecting the baby can include premature birth, higher than normal weight at birth, increased risk for type 2 diabetes later in life, low blood sugar, jaundice, stillbirth. The mother can develop complications such as high blood pressure, preeclampsia, or type 2 diabetes. She may also require cesarean delivery, commonly referred to as a C-section. The mother's risk of gestational diabetes in future pregnancies also increases. The bottom line: diabetes can lead to serious medical complications, but you can manage the condition with medications and lifestyle changes. Avoid the most common diabetes complications with these helpful tips.